Hi, my name is Dr. Chad Flanagan. I'm a general dentist with Virginia Family Dentistry. I've been with the practice for 10 years and I am in the Mechanicsville office. Today we're going to talk about dental implants, their multiple uses, and see if they're the right solution for you. A common misconception you'll hear people say you should get a dental implant to replace your tooth. The implant itself is actually the titanium post that goes in the jawbone. From there, multiple parts can be attached to the implant where a single tooth or multiple teeth or a denture is then attached to. For example, to replace a single tooth, you will have an implant that is then attached to an abutment and then a crown that is cemented to that abutment. An implant bridge is used in an area where multiple teeth are missing. An implant bridge has 2, 3, or more implants placed in the upper or lower jaw. From there, a bridge, which has multiple teeth that are all together, is cemented or screwed in. This is very similar to having one's natural dentition. When a patient is missing all of their teeth in the upper or lower jaw, an implant-supported overdenture is a great solution. Implant-supported overdentures have multiple implants placed in the upper or lower jaw. From there, and after healing, a denture is fabricated which snaps in and out, and the implants are then the anchors. This is a huge advantage when compared to conventional dentures, which mostly rest on the tissue. A patient can snap in and out an overdenture themselves, and we recommend them do that daily to help to keep the implants clean and the tissues under the denture clean. In my experience, patients greatly prefer implant-supported overdentures when compared to conventional dentures. The main reason is that an implant-supported overdenture greatly improves the stability of the denture. This leads to increased ability to chew, better ability to speak, and more comfort. When fabricating an implant-supported overdenture, oftentimes the teeth are removed and the implants are placed the same day. A denture is then delivered on the same day as well. Once healing is complete, roughly 3 or 4 months later, the patient then returns and that denture can be hooked up to the implants so that it can be snapped in and out. An implant-supported hybrid denture is similar to an overdenture in that the denture is attached to implants. The big difference is that the hybrid denture is permanently attached to the implants and only the dentist can remove it. The advantage of a hybrid denture when compared to an implant-retained overdenture is that the hybrid denture does not move at all. This allows for a patient to have an experience that's very similar when compared to natural teeth. Generally speaking, there are more implants required when comparing a hybrid denture to an overdenture because the hybrid denture is permanently fixed and thus requires a little bit more support. Full mouth implant crowns are another option to replace missing teeth in an arch. Full mouth implant crowns require multiple implants and include crowns, bridges that are all connected together. We've gone through multiple options that the dentist and the patient have to replace your missing teeth. Ultimately, it will be up to your dentist and you to decide which one is best for you. This will require an in-office visit, x-rays, possibly a CT scan to determine the most appropriate option. In general, the vast majority of patients are candidates for implants. There are a few absolute contraindications or conditions which we cannot place implants in, but for the most part, patients can go through implant placement. Ultimately, this will be up to the dentist and you to decide if you're a candidate. Restoring a missing tooth with a dental implant will require multiple office visits. The first visit is going to be a consult with your doctor. From there, your doctor will go through the timeline and how the process will work for you. Every patient is unique and each experience is a little bit different. The good thing though is it will not require multiple visits week after week after week. With the implant process, there's the implant placement and then multiple months of healing, then a follow-up visit. So although it's multiple visits, it's not in consecutive weeks. Oftentimes, once the dental implant is placed, nothing can be attached to it. This is because we have to allow time for the dental implant to heal. That healing is basically allowing the implant and the bone to attach together. Generally, it will take 3 to 4 months time for the implant and bone to heal enough for a denture or a tooth to be attached to the implant. There are options where a tooth is removed and an implant is placed and a tooth can be attached to it on the same day. Every circumstance is a bit unique, and this will be something that will be discussed at your consult appointment with your doctor. Based on my experience, patients are often surprised and relieved at the lack of pain from the implant placement experience. Generally, patients report soreness in the area where the implant was placed for 2 to 3 days. However, this can usually be remedied by over-the-counter pain relievers such as ibuprofen or Tylenol. Dental implants are a long-term solution to replace missing teeth. With that being said, continued care by the patient is absolutely critical. That continued care includes coming in for routine cleanings. Your hygienist or your dentist will further show you how to clean around your implant with floss and a toothbrush. Patients should brush and floss around their dental implants just as they do their natural teeth. This is required to keep the gums healthy and maintain the implant for a long time. Dental implants are an investment in your long-term health. Although there may be cheaper options available, I find that patient satisfaction is extremely high when compared to other treatments. Cost is a big concern when considering dental implants. At your consultation appointment, you and your dentist will go through your treatment needs while factoring in your budget and ultimately produce a plan that works for you. Thank you for spending some time learning about dental implants. I hope we've answered some of your questions and given you a better overview of how dental implants work. I'm sure there are more questions that you have, so please contact one of our locations for a free dental implant consultation.